Good afternoon, everyone, and thank you for being here. And thank you to FPA for having this event and putting together this panel. So to kick us off, I'd like to ask my first question to Sarah. Sarah, could you tell us why period poverty is an issue and what sort of consequences it has on menstruators?
Hello, everyone. So period poverty or menstrual health and hygiene is a human rights issue. It's a women's rights issue, and it's also a public health issue. So when we talk about period poverty, there are different aspects that affect a woman or a girl's life. We can first look at the health-related aspects. So if you talk about a woman's sexual and reproductive health and rights, for someone to be healthy, a complete physical, mental, psychological, emotional, to have that kind of a health, menstrual health and hygiene is one of the key areas when we talk about health. So we will talk about it a bit later, but definitely period poverty has affected women and girls' health and well-being in Sri Lanka. And then we have to also talk about missed opportunities when we talk about period poverty, where we have seen so many women and girls, especially girls, being unable to attend schools, missing schools, skipping schools, especially after the crisis. We have seen anecdotal evidence. We have spoken to our civil society partners. We actually see it when you go to a community, you see this situation. When you speak to schools, you hear about this. You hear it from the ministries, so you have enough and more data, even if it's not formally collected, to say that it affects schooling and education. And then if you look at women who are working, some women, especially who work in free trade zones and who do daily labor work, have missed their work because of period poverty, because they cannot access or cannot afford a period product. And then we also have to talk about the emotional impact and also the social isolation. So periods or menstrual health is something that's really, now it's a bit better in Sri Lanka. We hear the topic a lot. But when I first started volunteering with FPA and all, menstrual health was something that was very shush, and it was difficult to talk about. But still, it's the case in many areas. This isolates women and girls. The embarrassment, the taboo around menstrual health prevents women and girls from accessing opportunities that they should be accessing, so which end of the day affects gender equality. So if we are to attain gender equality in Sri Lanka, we have to talk about period poverty. We have to talk about menstrual health and hygiene.
Thank you, Sarah. My next question is to Dr. Harsha. So Dr. Harsha, as the presentation by Advocata showed and also mentioned by Sarah, there is a wide body of literature, not only from Sri Lanka, but globally, talking about period poverty, resulting in significant health, education, livelihood, and equality issues. If you could look back on the last few years from your time in government and also now to the economic crisis and the fiscal and policy adjustments that we are experiencing currently, what is your opinion on the continued taxation of women's menstrual health products?
I am for total removal of tax on menstrual products. And in fact, I have done the numbers, and we have shown to the government that it doesn't really cost that much. And the net result will be positive. Our calculations show that the tax collected by the government is only 0.0002% of the total tax. I think Advocata had done that number. I missed the presentation because I was 3 hours in a committee trying to resolve the central bank salary issue. Don't ask me how that went. But so the issue is, I think maybe you saw it in the presentation, Advocata says about 50% of individuals suffer period poverty. And if you look at only the girls in school, our first primary focus is on that group. So we did the numbers, and we came up with this amount of 750 rupees a month for these products. And then we looked at if all girl children, avail themselves of that amount through the school, that will cost about 11 billion rupees. But if we make it sort of a self-selection process, mothers who don't want their daughters to get that because they could spend it by themselves will not then take that amount. So we actually came down to about 4 to 5 billion rupees that the government should allocate for this in this budget. Sudarshini and I really took this forward through the Women's Caucus, and also a report was prepared by our committee, the Committee on Public Finance. We spoke to the Treasury, tried to see whether we can find 4 to 5 billion rupees to allocate for this. The Education Ministry told us that they were going to save something like 5 billion or so because they were getting some grant for school textbooks or something like that. And they promised us that they would work with us to reallocate that money. But unfortunately, we just checked, nothing has happened. So this is not something that cannot be solved, right? It is something, it is a solvable problem. I'll connect this with something else. When I wanted to start Soysa, 1990, when we brought into Parliament an act to support this, we said, look, it's going to cost about 4 billion rupees a year, right? And then, as some of you may know, there were a lot of opposition to it, but today it is the most efficient public service and the most loved public service in this country. And we spent 4 billion rupees. Now, we are trying to do an analysis to see what the actual impact of saving lives or saving people from being more than necessarily sort of, the government having to spend more than what it would have otherwise, having to spend on healthcare, what that net impact is. It's certainly going to be big positive. In this case also, it's going to be a big positive. So Sudarshini and I are fighting this battle, and I hope with everybody's support, we would be able to get to that point. So zero tax on menstrual products through a voucher provided for those who require, it would actually be free then in that case, not just free of tax, but free for some people. Others will have to pay, but not taxed.
Harsha, I'll just jump to a question I had coming on, but because you touched upon it, because you were talking about free sanitary napkins at a school level also, this has actually been something that countries like the UK and South Africa have put in place alongside the same time that they remove the taxes on their menstrual products. And so, you're having sort of a constellation of different things happening at the same time. So it's encouraging to hear what you and Dr. Sudarshini have been putting together. And because we have this audience here, could you tell us a little bit more about what is needed, say, from civil society and other folks in this space to take this further and to make sure that this doesn't end there? Like, how can others champion this further?
I mean, I think this itself is a good sort of message. Axe the period tax. I mean, I think we need a voice. We need a stronger voice. I mean, I usually, take on something that I think I can win. May not necessarily be right away, but this is a fight worth fighting, a cause worth fighting. And it is not that difficult to show that the net outcome is positive, right? So if civil society band together and led by Sudarshini and myself in the legislature, it is possible to make, I believe, what I would call a sort of a, structural change in the way of thinking in terms of taxing. And because elections are also coming, politicians may be more willing than otherwise to agree with Saji Premadas. What he said last time. Others didn't agree, but I think timing is right. Timing is right. 52% of the vote also.
Thank you, Harsha. And of course, when we are talking about period poverty, we can't not talk about economic crisis and the very real sort of dire situation that we're seeing at a household level, where we're facing a severe food and nutrition crisis. And this month, we've seen again high tariffs being imposed on essential food items. So, in that sense, now what we see is that things like sanitary napkins are becoming luxury items at households that are, they're having major competing expenses, whether it's tuition or electricity bills or water. Sarah, you touched on it earlier a little bit, but I was wondering if you could elaborate a little bit more about how women and girls have been adjusting during this crisis period when they have these kinds of competing expenses at a household level.
Can I just touch upon the previous point before I go to that? I think we talked about a return on investment kind of a conversation. So UNFPA is also working on it. So maybe we can actually look at how this affects the labor market and kind of make a case which will be compelling enough to push for the tax reduction or removal of the tax. So I just wanted to touch on that as well. But yes, deprioritization of menstrual health as well as health is obvious. When you go to the communities, it's very obvious that there are so many other issues with the economic burden, food, education, basically survival. So menstrual health products, so menstrual health is not the biggest issue, especially that comes to women's minds, and because women tend to deprioritize their health and well-being most of the time because of the role that we are assigned as well as carers and caregivers, having the dual responsibility of also working and also taking care of the household. But I also thought, of course, the labor force participation of women is also, according to the 2022 data, is 32.1, which is quite low, but we know this doesn't also capture the double burden like I mentioned. One more thing is, I read, I don't know the accuracy of this data, but only 35% of women use sanitary napkins in the country. That means others use other kinds of products. So when we look at a crisis and the ability to afford a sanitary product, it also comes to the question of choices and what's available. Of course, there are different products available, but are they affordable, are they accessible is an issue. Also, with Dr. Batu and the HPDB team, we are working on this reusable sanitary napkin standardization as well. It is available. Somebody also mentioned that they're working on, they're producing it and all that, but is it affordable? Is it standardized? Is it accessible to women and girls? So and I think a lot of women and girls still use clothes, and it's also about then, I mean, we have to talk about awareness and education. When we talk about period poverty, it's about education, awareness, it's about sanitation, it's about facilities and all of that. So education and awareness that women and girls have, also leading to comprehensive sexuality education in schools, is we have to talk about those things when we talk about period poverty. So I would say when tackling economic related issues, having access to a wide range of products and awareness is also empowering, and it's important. And also definitely addressing myths and misconceptions. I mean, a period cup is a wonderful product, but misconceptions around virginity completely prevents us even from talking about it in many contexts. So it's very important to talk about these areas when we talk about economics.
Thank you, Sarah. I think that's a nice segue to my next question, to Dr. Ranjith. Dr. Ranjith, removing period taxes is just one barrier. But there are other infrastructural considerations that need to be in place for menstrual hygiene management, say in schools. Could you tell us what the coverage or information for schools in Sri Lanka is like for things like water availability, sanitation, toilet to school girl ratio, for example?
Thank you. So the Sri Lankan setup in the schools, this menstrual health and hygiene has come to the forefront on the discussion, which we are very happy about it. And long time, the successive governments have been working on providing basic infrastructure facilities to the schools. So we are in a better footing related to some of the infrastructure, like over 92% schools having water sanitation facilities, and almost that high number having toilet facilities. And with the recent developments and having the interest on menstrual health, even though we don't have specific information about the number of girl-child ratio to and the girl-friendly washrooms or the toilets, the Education Ministry has thought about it, and they have a standard structure of a girl-friendly toilet, and some of the schools already have it. And at the Health Promotion Bureau from the Ministry of Health, we are looking at another angle. What we thought was having advocacy as part of our work. Our work at the health promotion. We have started a discussion among the top level agencies for advocacy, and we realized that a lot of ministries, in addition to health and education, should get together to sort this out. So about 2 years ago, there was a brainstorming session, and health ministry, our Secretary of Health, invited 9 ministries for a roundtable discussion, which included Ministry of Public Administration, Home Affairs, Provincial Councils and Local Government, and Ministry of Urban Development, Housing, Ministry of Technology, Ministry of Industries, Ministry of Environment, like that. 9 ministries were in the same, under the same roof, having a roundtable discussion, and they agreed upon a way forward, and all 9 secretaries signed it. And Health Promotion Bureau is giving the leadership for this advocacy component, and we are seriously looking at facilities for menstrual health, specifically at schools, and how the effect of menstrual products on our environment, how we are disposing them, because this is a very important component, because if we don't have that facilities right, it will be a deterrent again for menstrual health. So we are looking at a broad-based approach, taking advocacy to the next level for menstrual health and hygiene. That's one aspect we are looking at, and it's very supportive. All the 9 ministries, they are participating on the meetings regularly, and again, we have started looking at what are the standards for the menstrual products. If they are aware, at the moment, there's only a regular menstrual pad has a Sri Lankan standard, and now we have requested the Standard Institute to look into developing standard for the other products as well, because Sarah mentioned there are other products available at the moment, and we also know about that. And looking at a new product to see whether it's suitable or how to use it, and whether, especially from the health ministry, we are looking at the healthy component, whether they are okay, are there any adverse health impacts of these new products. So it's really important for us to have some sort of standards, and our standard agency is looking at what are the available international standards, and they have already started looking at how to adopt that. So I believe this multi-ministerial top-level advocacy group is a positive way forward into menstrual health and hygiene, and we are investing a lot on that.
This is a question I have for both Dr. Harsha and for Dr. Ranjith, and it's a question on standards. So this is something I got from an article that Advocata had written. I think Tatsarani had written it last year. So when you're pushing for para-tariffs, reducing tariffs, the cost of importing products will decline, fostering competition and subsequently driving down prices. This approach will incentivize local producers to innovate and develop higher quality products while ensuring that their prices remain competitive and affordable in the market. I was wondering if you could both give us your opinion regarding this, because in countries like Kenya, there are some concerns around the quality of sanitary napkins due to producers cutting corners to maintain margins. So how do we maintain quality if taxes are reduced or removed in Sri Lanka? And maybe Dr. Ranjith, you could follow from your comment earlier about the Sri Lankan standards.
Yeah, this has come to the limelight on and off. There have been certain agencies, certain organizations importing and getting these items used in the society. So at the Ministry of Health, we have a structure where all the districts and all the provinces are covered, and we have getting some reports from some of our provincial and regional directors also on the matter. So getting the standards in place is really important for us as a starting point. And I believe even the community, Sri Lankans, they are aware of the standards, and everybody in Sri Lanka knows the value of the label SLS. And so even we can see in the market also products by themselves, they are promoting having the SLS logo. So I believe getting the standards in place to all the menstrual health products is a way forward.
Well, in a country where you sell water as human immunoglobulin, I guess, you can sell anything to the people if you don't, follow proper procedure. I mean, the issue is, you see, there is almost an oligopolistic setup here, and by sort of creating more competition, what will happen is the consumer will have better choice, and if the quality is poor, consumer choice will certainly drive the producers to improve quality. And the mechanism that I was talking about earlier, on the demand side, through the vouchers, get the school children to sort of buy it, and on the supply side, there can be multiple ways in which you can create smaller or regional or newer suppliers and create competition and innovation on the supply side. So by creating that new mechanism of a voucher to create the demand, I would also sort of drive the supply. So look at it holistically. But another point that I wanted to make was, earlier you asked what can civil society do, and I just want to mention the names of these people who participated in coming up with what I mentioned earlier. Besides our committee, the National Democratic Institute, Westminster Foundation for Democracy, Advocata, Center for Poverty Analysis, and Verite Research, besides the Women's Parliamentary Caucus. So it's already a grouping that we have sort of put together, and like the UNFPA and others, willing partners, we are willing to sort of expand this and sort of create a much stronger, more powerful lobby to get this done.
Thank you very much. Sarah, could you tell us more about the activism and advocacy that has taken place in Sri Lanka regarding menstrual health equity and period tax? And if you could also touch upon how this advocacy has shifted with COVID and with the economic crisis in the last few years.
I mean, even before COVID, a lot of civil society organization and activists have been working on menstrual health and hygiene, sexual reproductive health, being very vocal about it. I mean, and then there's enough evidence and data. We don't have the latest data on certain things. We don't have, for an example, data on like schooling and things like that after the 2016 UNICEF WASH study. This is all data, but there was quite a bit of work that was done by the activists and civil society, that I must say. And then there were also champions in the parliament that also spoke about these issues, pushed for it, working alongside with civil society and academics, talking about the taxation as well as the public health aspect of it. So I would say the crisis or the COVID-19 kind of shed more light into issues around menstrual health and hygiene, and it brought up the issues, especially starting with schools and then how it affects labor force. So I would say there's more tension on it. There's more discussion around it because of the crisis and COVID. And then I can also see from where I stand, there's also a multi-sectoral kind of an approach to addressing menstrual health and hygiene related issues, but I'm not very sure about how progressive we are or how much we have progressed on reducing the taxation. But it's also not just the responsibility of the civil society, but it's, of course, we don't have enough data, so it's about having evidence-based policy making. So if we are to change a policy or change taxation, we need to have an investment case, we need to have data, we need to have evidence. That will help the civil society activism, a lot of great youth work that's happening, a lot of advocacy on digital and social media I can see around menstrual health. A lot of people are speaking up, including people with disabilities. So I mean, with that, if we reach out to the parliamentary champions, I think we would be able to really best advocate for this issue and the reduction or removal of the taxation.
I was just going to comment. When you say there isn't enough data, I don't exactly know what you mean by that, because are you looking at survey data, or are you looking at sort of data on expenditure? I mean, there is quite a bit of data in my view. It's just that we need to sort of collate it and sort of come together and create one strong lobby to get it done. And, you know, you want parliamentary support. I mean, I'm ready to champion this cause. You know, because we can really demonstrate that the loss of 0.0002% in tax is going to be compensated by much more in the gain in productivity, both in the workplace and at the school. So this can easily be demonstrated. And you mentioned social media. I think if, you know, I'm sure you can figure out a way to get this across to the population, you know, and create a wave, you know, on social media using data and, you know, sort of utilizing the work that has already begun with the support of the Women's Caucus in Parliament and others like ourselves who support this matter. I'm sure we can really change this situation. Otherwise, we'll come back here in a year's time and sort of lament, look, you know, nothing really happened. So instead of doing that, you know, our committee, because it's a committee on public finance, and we have been very vocal about this. And we've really taken it to the highest authorities. As a matter of fact, we called the Treasury and we found places where they can take money from. Now, for instance, the Sri Lanka Army has something called the other expenditure, and the other is 218 billion rupees, right? And we pointed out these specific places where they can pull out 100 million rupees, 200 million rupees. All we need to get it into the schools as a start is between 4 to 5 billion rupees. That is all. That is all. It's not a big amount when you look at, you know, the interest bill. This is about 2.1 trillion rupees. 2.1 trillion rupees. Right? And we are talking about 4 billion rupees. So this is something that can be done. And this is something that there is enough evidence sort of to change policy. I mean, I recall when we you know, took this to Mangala, and when Mangala took out the para tariffs, the import duties, immediately the prices fell by some amount. But then, of course, it got reversed. There was somebody who asked earlier about the IMF and the tax, and the person was right. There was no direct impact. It's just that, you know, there is a certain revenue that the government must somehow get into the treasury. But more than that, there is something called a primary balance, which is what the government gets and what it spends outside of interest cost, and needs to be positive. So there are certain criteria that we have to work towards, but this is a possibility, right? I mean, I don't think we should just talk about it and sort of take a step back. I think we mustn't take a step back. I think we must like push forward with this good grouping of different people from different agencies, institutions, government, private sector, NGOs, the UN. All of you guys are here, and Parliament. I am there. Others are there. I will guarantee you that we can put a team together. And if there are volunteers who want to work with that team, I will be more than happy. And NDI and WFT and all, I'm sure, will be willing to even fund this to sort of create a real, I don't want to call it an agitation or an aragalia, but create some real strong public lobbying to get this done. And I'm telling you, because it is elections, these different political parties will be more willing uh, than otherwise.
Thank you, Harsha. While I have you there, I have one quick question about safeguarding. I mean, there will be a lot of lobbying and advocacy needed to make these changes. But if we look at, say, countries like the UK, the research has shown that the reduction in VAT has actually not been passed down to the consumers. And in Nicaragua and Tanzania, they removed the tax on both products, and then both countries reintroduced it in 2019. So what can policymakers, civil society folks who, what you were just talking about now, how can we also talk about safeguarding those gains when we're also pushing for change?
Well, what happened to the tax that Gotabaya reduced? Did it go to the people? No. It didn't go to the people. It went somewhere else. And then they printed money to fill the hole, and we became the only country in Asia to sort of go belly up, right? So, I mean, whether it is Nicaragua, whether it is Sri Lanka, whether it is some other country, sometimes you reduce taxes. For instance, the classic case is this so-called sugar tax scam, right? We went from 50 rupees to 25 cents. Did people get the benefit of 49 rupees and 75 cents? The audit that was carried out by the Auditor General's Department very clearly showed that a few companies made absolutely, massive amount of unjustified profits. Why? Because they took it. 50 to 25 cents, 49.75 went to them, not to the people, right? So there was a complete failure in the Consumer Protection Authority and all these places. So there are certain agencies that are supposed to ensure this type of thing happens, but hardly they do, right? So my thing is the competitive spirit, right? And also there are some local companies, a few local companies who are sort of dominant in this. And I mean, they can actually even become bigger. They can sort of supply, a multiple of what they're supplying now. And they can even, as revenue to them, it can increase, right? So what I'm saying is, look, this is a holistic thing, looking at the para tariffs, looking at the value-added tax, looking at the subsidies, looking at sort of pushing demand, looking at how you can increase supply. And if we can come together on a sort of a step-by-step plan, I think it will be not that difficult to lobby the government to make the change.
Make the change, but also that it reflects on the consumer, right? Because I think what we've been talking about today is that it's one thing to remove the tariff, but if, from your examples, if any of the previous other price reductions or any kind of fiscal adjustments have not been passed on to the consumers, what we don't want is to see the same fate for this.
Yeah, I mean, that is dependent upon the competition in the market, no? I mean, if there are enough people, as opposed to one or two companies, enough people both supplying locally, produced locally, or supplying locally, imported, it doesn't matter. I mean, as long as there is competition, you drive towards a better quality, lower cost product. So if one company is not willing to pass down the benefit, and if they are not sort of oligopolistic about it and there is no collusion around it, then other company will do it. And with a voucher, it makes it so much more competitive, not just in the cities, but in the village areas as well.
Definitely. I think now I'd like to zoom out a little bit, kind of look beyond the menstrual products themselves. And this is a question for Sarah and Dr. Ranjith. We've been talking a lot about infrastructure, but specific to schools. But when we talk about infrastructure in the cities, so public toilets, availability of clean running water, and infrastructures like that, could you tell us a little bit more about, what is the availability, what are the sort of the infrastructures that you think we should be advocating for, promoting, because it's not just, we can't assume that everyone has access to a private toilet when they go into cities for work. For example, research with women gig workers in India show that women are less likely to be sort of Uber drivers or Ola drivers because there are no clean public toilets that they can use when they're driving during the day, particularly when they're on their period. And here in Colombo, we have lots of people who are engaged in the informal sector. We have a huge floating population who commute to the city every day. So in that sense, when we are talking about menstrual equity, how can we talk about our cities and our infrastructure also having those same infrastructures and high standards that we are talking about, say, at a school level or at an office level?
Yeah, I believe water sanitation, wash facilities in the schools need a little bit of revamping, because we believe for proper menstrual health and hygiene, there should be water facilities for cleaning the hands as well as cleaning private parts. So even within the same toilet or the restroom, these two areas of water supply is a must. We believe that. And even having the safety and security, whether the door to the washroom can be locked from inside, that's very important. Maybe we haven't thought about it before, but we badly need to think about it, especially in the public and even in the school setup. And again, having clean water. Fortunately, at the moment, our report says 91.8% of our schools have water supply, and we badly need to look at the balance 7% as well, and to make sure that running water is available. That would be one of the very important aspects. And again, I believe data is very important, especially for advocacy and for convincing. And some of the menstrual health related available data in the country is sometimes they are from maybe from one or two schools, or maybe from a clinical setting. And Health Promotion Bureau of the Ministry of Health, along with UNFPA, is very keen on having broad-based generalizable data from the whole country. So we have planned a study to collect this basic information, having a sample which will cover the 25 districts, and stratified and proportionate to the population, and getting all the necessary information. As Irak pointed out, that the currently available data says only about 35% of our women using some sort of sanitary products, and then obviously we would be wondering what the balance are using. So that would be should be a driving force to make all these changes which we are proposing. So this within the next quarter, we would be implementing this study, and hopefully by the end of the year, the data should be available. And one of the important set of data we are banking on is to see what are the balance 65% of females are doing if they are not using a sanitary pad, I believe. And again, this data would have a impact on the industry as well. They can see what a balance market will open up to them, and obviously they should know their maths. If the cost per unit is low, the number of units would be higher. So I believe this is a win-win situation for everybody. And about 3 months ago, Health Promotion Bureau, along with UNFPA, we facilitated the Ministry of Industry to have a discussion with all the sanitary pad importers and manufacturers in the country. And that was a very successful event. I'm sure Sarah will mention a little bit more about that. And that highlighted a lot of issues even the manufacturers are having. So I believe this working together for menstrual health, which is Health Ministry slogan for these activities, I personally believe we are moving toward the correct direction, and all the stakeholders here are helping us on that, and especially UNFPA.
I'll just add to that. So climate change is a very hot topic, and if we talk about climate justice, we also have to look at infrastructure, including, like Dr. Batuwanthudawe said, like water. And then here we can't forget about the product. So if we are, of course, removing the taxes and all that, introducing reusable sanitary napkins, but, disposable sanitary napkins, we are also talking about reusable napkins and products a lot. But if you're talking about Asia Pacific region and Sri Lanka, we are heavily climate prone to droughts, floods, all that. So most of the time what we have heard from the northern province is, okay, we can give reusable napkins, but if there's a drought, how do they wash it? Like, we have to also think about these aspects. Urban setup, yes, that's a different situation. Dr. Batu covered it, but in the rural areas also, hard to reach areas, and also definitely talking about communities such as women living with disabilities. I mean, when we were giving our dignity menstrual and maternity kits, there are pads in it. When we were giving it to the disabled women, when they were doing the sign language interpretation, explaining what's in the pack, when they said there are 3 packs of sanitary napkins, they kept asking, are you sure like there are 3? So for us, maybe like in Colombo, I'm not saying we're not sensitized, but we don't think like that. But for them, these are people from the Western province, this group. So it's a big deal to get 3 packs. So if you're talking about infrastructure, we have to, and reusable as options, and climate change, climate justice, we also have to look at infrastructure, including water and access and different other things.
Thank you so much. Thank you very much to all 3 of you for answering so candidly. I think we can open up to the audience now. I know there were some questions that were parked earlier in the earlier presentation, so I think now we can open the floor for questions.
I just want to know whether you all have thought about reusable sanitary napkins, or are there any standards that's going to come, or what's the availability right now in the country?
Yeah, during the last consultation we had with our 9 ministerial counterparts, this was discussed, and whatever the available materials were discussed, and out of that the SLS Institute coming under industries, they have agreed, and now they are working on how to develop standards for reusables, and if at all this menstrual cup and the tampon and the panty liners, and even we requested to develop some standards for cloth-based, but they were not in a position to take up that. As a priority, they are planning to develop standards for reusables now. So when it is done, they would move into the next item, possibly menstrual cup or something.
My question is related to how you take this discussion beyond this national and policy level. to the subnational and local levels. I think Sarah touched on it, but you touched on it mostly from the angle of social media and there being a lot of, interest around this topic. But as I think someone mentioned over there, the rate of digitalization in this country is not as high as one would think. Having a smartphone is not the, the kind of only way of sort of, getting this message out. So I think Harsha mentioned that there are a number of organizations, and together with those, you could have a sort of a swell of opinion to push towards legislative or policy change. But the organizations that you mentioned were all sort of Colombo-centric, Colombo-based national level organizations, particularly if you want to influence parliamentarians and if you want to influence the election agenda. What efforts are being made to make this something that is talked about across at different strata of society? And the added this is something that applies to many, many things that are talked about only at national level. But in this particular case, with this subject, you're also dealing with the stigma and the discrimination that anyway comes along with this particular topic. So I'm just interested to know what efforts are being made to make this discussion wider, and so that a young girl of 13 can actually talk about this without fear in her school, in a village somewhere.
Okay.
So the consultation also, we had big five, right? On like producers of reusable napkins, because they also shared a lot of knowledge with the SLIs, the certification, the ministries, all of them they shared, because they have done it and they have gone through a long process. We had I don't want to mention the names, but we have 5 of them who are already producing and who are already selling reusable napkins and underwears. So it's like a learning experience, because it's not quite clear how this has to be done. They also mentioned that there's this machine that needs to be brought down to check the standards and all that. But globally there are standards done by WHO, UNICEF and UNFPA when it comes to reusable sanitary napkins. We are looking at that as well, but also drawing from the local manufacturers' experience. So they were also part of the conversation. But just to add on, like, how do we get a young girl to be comfortable to talk about it? I think here the key thing is, we have to take another discussion on it, but comprehensive sexuality education coming from the school curriculum, formal education, to talk about menstrual health, not just with girls, but also with boys in schools. I know the Minister of Education and Minister of Health, HPP, is launching some of the CSE content on the 7th as well. And there are curriculum revisions ongoing. There are supplementary material specifically related to menstrual health being produced by the Minister of Education. There are lots of efforts going on, but we need to truly make sure the teachers are empowered. It goes into the right students. They're empowered to talk about it, and it becomes a normal conversation. So
this is for Dr. Harsha. By thanking you for taking this endeavor to reduce or give free sanitary napkins, I would also like to urge you to looking at the tariffs and the taxes that are imposed on raw material that is imported for the production of sanitary napkins locally. There are about 5 or 6 items that are listed, and some of them are used for other industries as well, and therefore the taxes are imposed on those at a very high level. So looking at that, and also including this in your move to eliminate the taxes would be very, very appreciated. And also would like to ask Sarah whether you have looked at the biodegradable sanitary napkins that are being produced even in India, and some of them are produced here locally in Sri Lanka now.
They have made representations because, like you said, it's not only for one particular use that these raw materials are brought. So if the raw materials are brought, say, permanently for the use of sanitary napkins or adult diapers, for instance, and they're used for something else, then there's a problem, right? So how do you sort of distinguish the use? I don't know exactly what the answer to that question is um, uh, because of the multiple use of uh, of the raw material. But your point is valid, but I don't really know exactly how to address it. I'm sure that we can get expert opinion on it and see how to do it.
I think you can take it on. It's the gum and the release paper that is used for other industry as well. And we hope you will take it on and we'll see some result.
Let's see. You can sort of, we can engage on this
Thank you.
afterwards. Thanks.
Quick response. We are looking at it. We have had conversations with Ecofem and a few others in the region. And they are large companies that are doing it very successfully, also involving women from rural areas for production and all. But I also know a few companies, including Celine, also they're launching their pads this month as well. They mentioned like formally, they also went through a lot of process. There are others like there are a few Japanese led civil society, not civil society, sorry, entrepreneurs as well and manufacturers who are working on it. We are having conversations, but there are different ways. That's the thing. There are different standards. There are different ways of doing it. It's not standardized. So that's one of the challenges we have to say which one is the best. It's very difficult for us to say. So we provide free sanitary napkins, but we cannot add usable products into that pack because it's not approved or accepted by the NMRA in Sri Lanka. So there are some challenges.
Hi. So adding on to what you said about abortion rights, something that we can see clearly in Sri Lanka is that one, women are not involved in the decision-making process when it comes to basically legislation that affects women. We can clearly see it. And it's a big problem in the entire world, but it's worse in Sri Lanka. When it comes to abortion rights, when it comes to period poverty and all of that, how do we address that issue? Because the women who, people who understand this issue are not the people who make the decisions. And as he said, Dr. Harsha said that you're planning to bring in legislation about this period poverty and removing the taxes and all of that. My argument is that we saw how the online safety bill worked. Everybody was against it, nobody was for it, but it still got passed. This is something that we are all supporting, but it's never going to get passed. Same thing with the the private members bill for decriminalization, basically against 365 and to amend 365 and 365A. It's again a private members bill that's been in the loop, I think since 2022, I think. And honestly, I think somebody told, I think it's Bassett who said today that if the parliamentary election can even happen this year. So the parliament is about to end, like the session of the parliament is about to end, and we haven't seen anything that is worth, that would make a change in parliament that was passed. So how do you deal with that? Because I know you said that it's the election season and all of that. How can we, as civilians of this country, as citizens who are affected by these decisions, make enough noise without going for another Aragalaya or conspiracy or whatever? How do we make enough noise to make that change? Because at this point, people in this country are not empowered. This doesn't look like a democracy. So how do we address that issue?
I mean, yes, things that we don't necessarily agree with gets through parliament because the way our democracy works, if you can manage 113, then you can get anything passed. I give you an example. The no confidence motion against the health minister was defeated because there were 113 saying, look, there was no problem there. But we know there was a big issue, right? online safety bill and others. See, it is sometimes disappointing, but that's how democracy works. That's how it works. I mean, all 225 of us are supposedly representing the 20 million of us. So we are sent there to represent the bigger us. So if it doesn't happen, how do you deal with it? In some countries, there are ways in which you can recall your representative. If you vote in a way that is sort of not representing the constituency that he or she represents, you can sign a petition, and if you have a certain number of signatures, you can recall that member and have a by-election. We don't have things like that in this country. We don't even have post enactment review, judicial review. So for whatever reason, you sort of create some sort of legislation, you pass legislation, there is no way after that legislation has been enacted to relook at it. So these are some of the changes that I think if you're looking at this progressively, we need to consider. But unfortunately, that's how democracy works. I can't change that. You have to be able to send people to parliament who truly are going to take your fight to parliament. Sorry, I couldn't give you a better answer than that.
I'll quickly touch upon the questions on termination. So since before 1995, I know lots of, it was in the parliament, parliamentarian, civil society, medical professionals have been pushing to change the law related to abortion in Sri Lanka. And if we take stock of 1995, 2005, 2016, all of that, the main reason was the opposition that we received from religious leaders. So I know there are conversations from a health perspective, specifically looking at rape, incest, and stillbirths and congenital malformities to look at how we can look at the law related to abortion. I mean, these conversations are ongoing, but then there are also other conversations. Should we not only look at congenital malformities, but not rape and incest? Because we can, they say they can find solutions for those. So there are different kinds of conversations going on, but it is obviously a sensitive and a difficult topic. But today I read France made it a constitutional right to have access to a safe abortion for every woman in France. So we have a long way to go, but post-abortion care is available and legal and provided, so that's there. But when we talk about women's bodies and rights, we definitely need to, and sexual and reproductive health and rights, termination of pregnancy is one key area that we need to definitely pay attention and focus on as well, because I know the numbers are not so high when we look at maternal mortality due to postpartum hemorrhage or because of septic abortion and all that, because of the medical abortion pill and the availability. So that there's little attention on, because the maternal mortality rate is not high because of that. It used to be the second or third course, but now it's 8th or 9th, it depends. So there's less conversation, but yes, it's a very important area to look at as well.
Thank you very much. Unfortunately, we have to bring this session to a close, but I think if there were any more questions in the audience, our panelists will be available after if you have any burning questions. I think for a lot of people, period tax or axing the period tax may be sort of like a low-hanging fruit in terms of advocacy, but I think what our three panelists have showed is that it is a lot more complicated than just axing a tax. There are so many other components, different actors that are in place and need to work together to make this a reality, in addition to other things like access to clean water, affordability of products, and so on, and quality. So I think before I bring the session to a close, I just want to ask the three panelists if they have any last comments that they would like to leave with the audience, or... Okay, I take that as a no. Thank you very much, everyone, for being here. And I think Rashmira will close the session officially.